Hi everyone, bonjour tout le monde. We are here for our second live stream Q&A session in this format. This is the first, we went live in July and now we're trying it again. So thank you very much to everyone who is online and watching and who participated by submitting questions. Ceci, c'est la deuxième live stream.
This is second live stream in this format. The first was a direct in July. It seems that last month went by really fast, but we wanted to repeat the activity to learn.
Seeing what questions that you have and the variety of the questions, the differences between the questions, the similarities, and how these questions were different from the questions a month ago. So we learn as we do this, and we appreciate you flagging to us the kind of things that you want to know about. On a utilisé le...
We used the Mentimeter tool to help us with the questions. So it's an independent website. We promoted it for the answering question and answer on our social networks. And the system we're going to use this time is the same system that we used the first time. So you submitted your questions and they were open to see. We're going to take the questions that are the most popular or that received the greater number of votes, and we're going to answer as well. Well, as many questions as possible during the hour that we do have.
Same this time as last time. Mentimeter, an online website that's independent from the government, was used, and that's where you submitted your questions and voted on other questions, and we are going to be tackling the questions that received the most votes as much as we can in the next hour. So hopefully we'll get through another dozen, 20 or so, I think, like we did last time. I do want to clarify, a couple of folks have suggested that we have deleted questions or modified questions. That's not the case. If you go on and if you're willing to scroll, you will see every question submitted there, some questions multiple times, some questions with language that we wouldn't use in a program like this, but they're there as you submitted them. Alors,
So we're removing no questions. You could see this is one of my issues, that the difficulty of seeing all the questions that are submitted. We have to do a major scroll to see the most popular question, the most recent question, and we have to click to show me more, many times over to see all the questions because there are many of them
submitted. So you can imagine trying to find yours means a lot of scrolling through to get to where those questions sit, but they are there. So what 290, more than 290, 300 and some questions submitted as of an hour or two ago. We had about 240 or 50 of those in French, and I think there were 52 submitted in French, 260 submitted in English. So that was the breakdown because we did have those two different sites. On a reçu plus que deux.
We received more than 2,175 votes on these questions. So many votes for the questions, but the number of participants was 171 rather.
People voted 2,175 times on the questions submitted in order to give us which ones have bubbled up to the top. One thing we have done just to try to smooth out the process of answering questions is that we've grouped them together. So as you can imagine, there were lots of healthcare questions. Where they've been about the same topic, we've grouped them together, and I'll attempt to answer all of those in a group, whether it's about the hospitals, ER, or primary care, or education for healthcare, that kind of thing. We've grouped those together, so we won't go in the exact order of the votes where the subjects are similar. C'est la même chose pour l'éducation.
Same thing for education, infrastructures. There are many questions for the Department of Transportation and Infrastructure. So we tried to get them together, put them together as much as possible so that I can deal with the question and with issues in its entirety, if possible.
many as I can in the time that we have. We continue to want to hear your feedback about this, whether you find this is a useful hour of your time to capture these answers, whether you think that there's a different or better way to make sure that we're constantly listening, engaging, and understanding what New Brunswickers are wondering about, what questions the population has, and that we're then providing those answers in a timely way. So we do this in a variety of ways, I will say. Obviously, the government receives phone calls, receives letters, receives emails and inquiries that each get answered in those different ways at the departmental level, through the Premier's office as well. But sometimes when you get a question that's been asked a lot of times, an environment like this can be a good way to try to tackle that subject. Alors, on veut entendre votre feedback.
We want to hear your feedback. If we're trying to answer the issues that are of concern to you and questions that you do have. So let us know if you believe it's working well, if it can work better, or any other way that we can get your engagement to make sure that we're listening and hearing your questions, and that we give you the information and the answers that you need in the way which is useful for you.
Rambling for me. I know, oh, there it is. I was going to say the team told me that there was a clock. I had to look for it, but there is a lovely digital clock sitting on the chair beside the camera telling me that I'm about 7 minutes in and that I should stop rambling and get to the questions so that we can get through as many of them as we can. So the very first question, and this struck me as kind of interesting. It was an underdog question, I'll call it. It wasn't at the top of the list when I checked yesterday or the day before, but picked up some steam and some extra votes today. So with 81 votes, the most popular question submitted this time around was the following. Why can't I log in to a single website and see all the services that I currently am receiving or could receive from the government? And so 80 of you thought that this was a question that you really wanted to have answered, which, as somebody who grew up as the kid of a computer programmer and who started her career in IT, I really appreciate this question. So thank you, whoever asked it. And unfortunately, I don't have a great answer for you. There's a lot of different reasons why, but one of the reasons why I really like the question is because that is the ultimate goal. The ultimate goal would be that you could go to one place, one accessible digital place, and provide information about you, and then see all sorts of different information about how you interact with government and receive government services. Right now, we have multiple systems that do that, and the reasons why are many. One is that a lot of the systems were built independently of each other, so healthcare information sits within healthcare information systems, education information sits in different systems, information about your taxes, your property taxes sits in another system over here. They're not all built the same way, they're not built to talk to each other, and they're not built using the same data identifiers person for person. Some are identifying you based on your address, some based on your Medicare number, some based on your social insurance number, some based on other things, and they don't necessarily keep all those connecting pieces of information together so that you can provide one detail and get that whole picture. The other reason is privacy. So a lot of this information is held by the organization that has it and has the permission to have that information about you, but does not have the permission to share that information with folks in health or folks in finance, the same way that finance doesn't have permission to share your financial information over and across to a healthcare system. So getting to the point where we have the kind of information systems and data layers where you can say, I'm Susan Holt, here's my social insurance or Medicare number, and it can then pull up the taxes I owe, the parking ticket that I just got, the score that my kid received on their last test, the results of my last blood test, put all that information in front of me and tell me you're eligible for this kind of assistance and you're eligible for that kind of program. That's the goal. It would be incredible if we could get our IT systems to blend together so that you, as a citizen of New Brunswick, could have that view on all of your different interaction points with the government of New Brunswick. So that is the ultimate dream. I would say we're a long way away from that right now with the systems that our different government departments are running on. Some are quite a bit newer, and we're actually heavily invested right now in a clinical information system on the healthcare side, because you might hate to hear this, but our hospitals don't all run on the same systems. So there's one system if you're at a hospital in St. John, and it's a totally different system if you're at a hospital in the Upper River Valley. And so we need to make sure that even that health data within health talks to each other. And so building out that clinical information system that connects with the electronic health records so that we can have all of a New Brunswicker's health information at our fingertips is an undertaking we're going through right now. Building that out so that it then connects with the rest of your engagements with government is not a current project that we have on the go, but we have some great people in our Office of the Chief Information Officer that are looking at the digital government, the architecture that we need in order to make sure that citizens can access what they need when they need it, and that they can control the privacy of that information. And I'll just put one final plug into the team that looks after things like the government website, because the government did just redesign its website to get closer to that usability, get to know me, know what I'm interested in, and provide me with the information that I need when I'm asking about, funds available to start a business. Get me to the different programs and put those options in front of me. So there's been some work done to really modernize some of the government's online presence so that it is a lot easier for New Brunswickers to find the information that they're looking for. So thank you for asking the question. Thank you for caring about that kind of connectivity, or single sign-on, or single record, as we like to call it. Something that we want to be working toward. It's not the case today for a whole bunch of reasons in terms of the state of our technology systems and our privacy rules and how things were built. But it's good to have top of mind every time we make a decision about what information we collect for New Brunswickers, what information we put in front of them, and how we make all of that seamless to the user. So that one was, I don't think that showed up last time. I loved that it came up this time. The next most popular question, and I will say that the data that I have here on the votes is a couple hours old. So if you go on the website right now, the numbers might look just slightly different, but we did pull this about an hour and a half ago, I think. So the next most popular questions were on healthcare. Probably no surprise there. That is the thing that I spend probably the majority of my time working on and thinking about, and it was clear that that's the same for New Brunswickers in terms of their questions. So with 79 votes, the first healthcare question that we received was, when will New Brunswick take action on our current situation with hospitals? It's bad enough that the ER is overcrowded, but nurses are also ignoring patients and playing on their phones in Fredericton and Heartland. There was another question that got 67 votes that says that the wait times at the ER are still crazy, and what are we doing to bring in more doctors and nurses to the province? And another question with 54 votes that said, does anyone currently audit our hospitals? I went to the Upper River Valley Hospital for an injured foot in the middle of the night, and the lady who did the x-ray reeked of alcohol. So I'm gonna talk about the situation in our hospitals and what we're doing and try to get at all three of those points. Because, as I said initially, we know that the healthcare system in New Brunswick is not where we want it to be. It's not where we want it to be for the patients who are experiencing it, and it's not even where we want it to be for the healthcare workers that are working in those conditions. And so that's why I meet every other week with the Department of Health. That's why we've committed to doing things to help attract and retain our healthcare professionals. That's why we're committed to changing the way that we do primary care. So a couple specific things there. One of the first things we did in government was issue those retention bonuses for nurses. That happened last November, as well as the beginning of this fiscal year. So that's related to the question it was asking, what are we doing to get more nurses into the province? The first is keep the ones we have, so that there's fewer positions to backfill. And then by keeping the ones that we have, it's making sure those working conditions are attractive to new people that we want to get to fill them, because one of the worst things for the folks who are nursing right now is being short shift and showing up to work where there aren't enough people to cover the patient load or the workload, and that not being a great environment to recruit into or to retain into. So we need to fill those empty positions. We need to make sure that folks have the kind of teammates around them that mean that they can deliver safe and good health care. But that doesn't get quite to the issue that you raised, which I'm going to get to at the end of my question, because I do want to talk about the ER issues. We are hearing certainly that our hospitals are full of patients in beds that are looking for alternate levels of care, and that's causing issues in the ER because there is nowhere to admit somebody into in order to deliver them the emergency services they need, and it means that we still have hours and hours long waits in our ER, even though our team has been focused in November since we started in getting the primary care solutions in place to give people care in their community, which means that they don't have to go to the ER. Right now, it's the only place to go for some folks who don't have a doctor or a family health team. And so we committed that this year we would put in place 10 of these transformed primary care models. Family health teams, we're calling them, collaborative care clinics. The names have changed a bunch of times, but the idea stays the same. A group of healthcare professionals working in a team in your community, close to home, with the flexibility where you can walk in the door because you or a member of your family is sick, and they will have time for you. You can get an appointment within that day or the next couple days, that they will have the right person to see you because they're staffed with nurses and nurse practitioners and counselors, and they're next door to a pharmacy, and they have the kind of doctors on the team that can address your issue. We've created 5 of those family health teams this year, and there are 5 more that we are going to open up in this calendar year to meet our commitment of 10 family health teams in New Brunswick. And each of those family health teams will be taking more people off of the current wait list for care. And that's meant to relieve the pressure at the ER, because if you have a family health team, then you don't have to go to the emergency room to join the wait for care and add to the length of time that means for the folks who are there. There are a number of other pieces to optimize our ERs in terms of how many ER shifts we staff and when, the process for making sure that beds are available, making sure that all of the required nurses and physicians, assistants and others are there and being fully utilized. And so that work continues at the same time as we try to prevent people from coming into the ER. So these kind of transformations require a whole bunch of shifts. Moving to this family health team model means a change in the compensation system. So we're negotiating with doctors and nurses right now. It requires a change in some cases to physically what clinics look like. They're no longer a wicket and a nurse in a doctor's office, but rather spaces that can accommodate more professionals who will work together in different ways. So we're doing expansions and renovations and that kind of thing to make sure that the healthcare spaces are available in your community that are attractive to the healthcare professionals we need. So that's the other piece in relation to attracting doctors. We have to make sure that the pay is competitive here. It's partly that's something that we do regularly, but we're negotiating with the Medical Society right now to ensure that New Brunswick healthcare professional compensation is competitive and attractive to get the people we need here. We have to make sure the model is attractive, because doctors today don't want to invest in their own business and take on the paperwork and the hiring and staffing and the leases and everything involved in setting up an office. They want to walk into a turnkey operation. And New Brunswick had a lot of standalone, single practice family doctors and not a lot of these teams that new doctors could walk into. So we were losing those new doctors to the provinces that had adopted those models. So we are rapidly rolling out this collaborative model with a lot of flexibility so that the pay and the work model is really attractive to doctors. Our recruitment team has been down in the US, taking advantage of the opportunity to attract some American healthcare professionals who are really looking to get out of that country as they watch investment in healthcare and research decline. So we've been doing some recruitment activities in different key locations in the US. They continue to do recruitment at all of the schools that are graduating healthcare professionals in other jurisdictions around the world. to show people that we have the new models, the planned investment in technology and systems that makes New Brunswick an attractive place for doctors. And we've been doing things like the Practice Ready assessment system. So as people come here who have been doctors in other countries and provinces, they can practice as a doctor in New Brunswick right away. So if you have a Canadian credential, if you've been licensed to be a healthcare professional in Saskatchewan, you can come to New Brunswick and you can be free to practice. You just have to let the registrar know that you're here, send them your name and information, and then you can get to work as they process getting you registered into the New Brunswick system. That's helping us recruit. And then if you're coming with a foreign credential, we have a 12-week program where you get on the ground, in community, mentored by and supervised by local family doctors and others. And then through a 12-week program, we can get that supervision signed off on and your skills validated. And we had 12 people graduate from that program. This year, we've got more people in the program. That's starting in the fall, I think in September, because we're looking for ways to rapidly accelerate our adoption of healthcare professionals. It used to be, you'd come here, you had to register, you had to take new courses, you had to go through a bunch of your education again. It took years to find somebody who would supervise the placement. We've shrunk all of that down into 12 weeks so that we can get the benefit of the healthcare skills and education that people who have chosen New Brunswick have, and we can get them in caring for New Brunswickers. So there's a lot of different pieces. Like I say, the compensation, the practice model, recognizing people's credentials, recruiting them from other places to come into New Brunswick, those retention bonuses, and making the working conditions just right so that that pressure on the ER and those waits go away, that our hospitals are being used for what they're supposed to be used for, and that great preventative primary care is happening in community where you need it from the team of professionals who can share the work and make sure that you and your family are getting the care you need outside of the ER and waiting room. So I want to just, on this final one, because there's a couple different points here about people playing on their phones or smelling like alcohol, there is a process where we audit hospitals and hospital performance, because it's incredibly important to make sure that the people who are charged with caring for us, keeping us alive, if we're in the emergency room, or meeting our healthcare needs and issues no matter where we are in the system, that we have the right people doing that work responsibly. So both of the regional health authorities who operate New Brunswick's hospitals have an audit function. They also have people responsible for hearing exactly the information that you put in these questions, and ideally as soon as it happens. Complaints are best delivered and handled as close to the time when they happened and observed as possible to give the health authorities the tools to go and capture it and look into it. So there is a patient relations department at Horizon and a patient's experience department at Vitalité. They are looking after the safety of care, the quality of care, and these patient experience and patient relation departments are confidential environments for patients and families, so you can express your concerns that you've witnessed in terms of staff behavior to those folks, and they are equipped to handle that information anonymously and make sure that the people who are being paid to care for you and who are doing so as a public service are doing so safely and responsibly and to the quality that New Brunswickers expect. And so I would encourage folks, if you see or if you experience some of those examples, to contact the patient relations departments at either Horizon or Vitalité, depending on which system you're in, and flag that to them so that we can address it. Okay, so that was 4 questions. We're going to go on to one of the next most popular questions. This one was was about DTI. So it had 78 votes. And it was, why do construction projects in New Brunswick never operate into evening or overnight hours to minimize disruption and reduce project time? Do our contracts not incentivize contractors to get the jobs done faster? So this was an interesting question to me. I read it and thought, yeah, I have seen some projects happen at night, but not many, and I wonder what the rules and the decisions are in relation to that. So I reached out to the Department of Transportation and Infrastructure, to my colleague Chuck Chasson, the minister for that department, to find out what the process is in terms of night work in order to really reduce the disruption in those communities where you find yourself sitting in the end of a long line of traffic waiting for a project that feels like it's been going on for days, weeks, months through the summer. So DTI was pretty clear with me that their number one goal is safety. That's in part why the department exists, to make sure that we have the kind of infrastructure that New Brunswickers can move around our province safely, and that's safety for New Brunswickers, motorists, and users of the infrastructure, as well as safety for the workers who are on those job sites and either flagging or working the road or bridge or otherwise to get it into its next state. And they said there's a lot of concerns and a lot of risk related to overnight work. Because of reduced visibility, the potential for accidents is greater compared with daytime work. So there are health and safety measures that need to be put in place for overnight work, proper lighting, particularly if you're doing construction work. You have to be able to light the site and implement a lighting solution. That can be really challenging to implement depending on the work site and still allow for either traffic flow or safety procedures. Generally speaking, contract crews work all of the daylight hours from the time the sun is up until the time the sun has set, and so they're putting in long days, 12, 13, 14, 15-hour days, and so to continue the work can get expensive and also be less safe because you're taxing your crew pretty heavily, and it can be challenging to staff those kinds of shifts and hours overnight. They did tell me there are some projects that schedule work after hours, and impact on operations is a part of why they consider doing that. But really they're looking at cost, possibility, safety for everyone involved to evaluate whether overnight work makes sense. And a lot of times just the act of trying to light and make sure a site is safe alone overnight and in the dark is a limiting factor. The other piece of the question was about contract incentives. So most contracts, I was told that most contracts don't have incentives for early completion. The incentives have sometimes been used like that on key projects where we're trying to reduce disruption and get it done as quickly as possible. So it is a tool that has been used occasionally, but not standard. Incentives aren't a guarantee that a contract is going to get completed early. Other delays can take place, and we've seen that happen in some major projects here recently. What we do to try to motivate a timely finish is the way that our payments are released. So contractors don't receive full payment until a project is complete, and that alone incentivizes them to get the work done in order to get paid. And there's been some work done on prompt payment from the government to our contractors to make sure that once the job is done and it's been signed off, that those final payments aren't lagging. But that certainly drives a contractor to want to get a project assessed as complete as quickly as possible, and then they can get the crews out on another job and working. So thank you for that question. I'm going to do one more English question, and then I'm going to switch over to the most popular French questions. But there is translation if somebody has been watching this in English wishing for the French. There is a French GNB channel that you can watch the stream on, and an English one. And I don't actually know if we have an update on the bilingual channel that I think I talked about last time. Next month. Next month you can watch raw footage, où je parle en français, je parle en anglais.
We speak French or English. I switch languages to add to the English channel and the French channel.
That ready for those of you that like both languages, but if you've been wondering why I haven't done any French questions, the next question is coming up in French, and there is a French GNB channel as well as an English channel to watch this live stream. So, next most popular subject was education. There were 69 votes for this first question, which was, why are we introducing a pilot to increase professional development days by 230% and reduce learning days for students. Teacher training should be done over school holidays, not at the expense of our children's learning. And then there was a similar question that had 55 votes that stated, removing 10 days from our school calendar this fall is flawed policy. Research demonstrates a strong positive correlation between class time and student outcomes. Will you halt this pilot? So I'm keen to talk about this one because we've had a lot of feedback on it. We know it's something different. And so I want to tell you why we're doing it, what we're hoping to learn and gain from this pilot, and respond to some of those specific pieces. I have heard now for a number of years about the need for stability in our education system, the challenges that schools, teachers, students, and parents were facing due to our teacher shortages, where we started employing more and more supply teachers, and to the point where we were actually employing supply teachers without experience in education because we needed adults in classrooms. And so that's the access to qualified teachers to make sure that we have people who are professionals in education in every classroom in New Brunswick is still something that I'm very worried about. The forecasts show continued retirements. We don't have a backfill coming in of all of the teachers that we're going to need in the coming years, and the expectation is that we will continue to be in a pretty severe teacher shortage for years to come if we don't make sure that we have the kind of roles that people want to do as teachers. And I think the most important thing to a student's education is having that motivated, qualified, educated teacher in their classroom to help them achieve their best. We want to see our levels of literacy go up. We want to see our levels of numeracy go up. We want to see our absenteeism rates go down, because none of those are at the levels that we would want. And that's why we made those 3 commitments as a government, that we were going to focus on improving student literacy, improving student numeracy, and reducing absenteeism, because to the point that's being made here, a student that isn't in a class or is missing class and missing content is not going to be able to achieve those higher levels of literacy and numeracy. And so we were looking at a whole bunch of different things. How can we improve literacy results, numeracy results, absenteeism results, and tackle the teacher shortage that we're facing, making sure that we have qualified, educated teachers in classrooms that are motivated and have the tools and resources to do their best and be the best possible teacher to get the best results out of those students. This pilot project has actually first happened on the Francophone education side. So they launched the alternate calendar, giving teachers time on Fridays to every other Friday, I believe it's the same structure, to spend with each other, working with their teammates on solutions for particular students that need more help or that need more challenge, to work outside of the school with the counselors and the other professionals that may be involved in a particular student's case, to engage with parents and others on how to best support that student with their educational opportunities. In a regular week, teachers don't have time to do all of that engaging with their colleagues around them, with the partners outside of the school system, and with families to the extent they want to. That doesn't find them working late into the night and into weekends, and still stay on top of the best ways to teach math and the best ways to teach literacy, and to follow up on those students that aren't showing up to class, and to deliver the kind of supports they need to all of the different learners in their classroom. We are seeing some encouraging results on the Francophone side that tell us that this is having a positive impact in terms of reducing absenteeism, a positive impact on teacher retention and attraction, and we're waiting to see the meat of the data on the results for literacy and numeracy, because those testing points are harder to get at in a one-year pilot. And so we were also hearing from some of our school leaders that teachers were looking to move to the Francophone system, that the Anglophone system was at risk of losing the teachers that wanted to move over to the model where they would have the time to engage with their teammates on specific students and on their plans and how the whole school supported a student achieving their potential. So we also have research that shows that when you invest in a teacher's performance and give them the tools to manage their classroom, their students' learning, and give them those opportunities both to work with each other as a school team, to work with the parents, and to work with the curriculum, that they perform better. And investing in teacher resources produces better results from students. So I think that that's pretty self-evident to me. The best teachers produce the best results from students. And if you want the best teachers, then you give them the tools, the time, the materials to build that team in school, to build that team in community, to serve your student. We also looked at the levels of time that students are spending in school in New Brunswick. New Brunswick was at the higher end nationally of classroom or instructional time, and with this pilot shift, we'll go into about the midpoint or the average as we look at schools in Alberta and BC and Ontario and how many instructional hours those students are getting. And so this isn't putting us way out of whack. This is still keeping us just in line with the instructional hours that students are getting in other provinces and other programs. But I will say there's a big difference between number of hours and quality of hours. So I know as a parent, I have kids that sometimes spend time in school that is, it's movie time, or it's time spent doing things that I wouldn't describe as instructional hours because they have to manage the staff that are in the building. There's things that need to be done to make the school work. And then there's also, I could talk about all of the dance competitions, or for some of you maybe that's sports tournaments or others that the kids are constantly being pulled out of school for, that I've worried about as my kids have missed school for all of those extracurriculars that some of them are in. And so we believe that this calendar will allow some of that to happen. So those extracurriculars, those sports tournaments and others, there's a place for those where those students aren't missing school. For the kid that is finding themselves burnt out and does not want to come to class and is telling their parent, oh, do I have to go to school today? It's Wednesday. No, I don't want to. Mom, I'm not going to school. It's Thursday. We've seen on the Francophone side that when they know, you know what, you get a break this Friday, that benefits that child's attendance throughout the week and throughout the other days. And so that's why there's been a positive bump on absenteeism. So data says that when you invest in teachers and make sure they have the tools and time to be at their best, you get good results from students. We're watching the instructional hours to make sure that those instructional hours are well used by teachers who are motivated, energized, and engaged in that time, and that it remains on par with the Canadian average. We're looking at literacy and numeracy results to make sure that this investment in the system pays off in terms of student outcomes, and that's why we're doing it as a 36-school pilot. So we have hundreds of schools in New Brunswick. We've identified 36 where the parent communities were interested in this, the teacher communities were interested in this, the district was supportive. They said they want to try it. They engaged with their parent support committees. They got the buy-in from their communities. And so those 36 schools are going to try it on the Anglophone side this year for us to see how it goes. We weren't prepared to make a wholesale shift based on the research saying this will improve outcomes. We wanted to test it out and see. And that may take a year and that may take 2 years, depending on whether we can get sufficient data from the pilot to give us a sense of whether it's working or whether it's not working. But right now, we need to have an attractive education system for the best teachers out there to want to come and work in, to fill all of those vacancies, to make sure that we have qualified, educated people in the system. In my ideal world, we would reach a point where we have resourced our school systems with not only the teachers, but the guidance counselors, the behavioral intervention specialists, the academic support folks, that those schools are full of the right staff, working in teams to support that classroom, such that one teacher could go out and engage with their other colleagues, with parents, with counselors and others, and that class is still operating. But right now, we are so short of teachers. I think we have last number I heard, I thought was 160. Hopefully that's come down. Vacant spots for teachers that we don't have the flexibility to allow someone to go and engage with their teammates during the day and still have that class be on track. So ultimately, we want a well-resourced education system with teams of people that have the time to focus on your kids and make sure that they are learning to read and write and do math, and that they're in school and supported, so that we end up with the best results in this country for our education system. So that's why I think this pilot is worth doing. We don't have plans to halt it. We have plans to evaluate it very carefully to see that it delivers on student outcomes, on absenteeism, and on teacher retention and motivation, so that we can have the best people in the best system getting the best results for your kids. That was a long spiel, and I have some notes here that I want to make sure I covered. But I think I did. So happy to talk more about that one, because I understand, even as a parent, like, what do you mean my kid's going to be in school 10 days less next year? And I sure hope those correlate with dance competitions just to make it work for us. But I totally get the fear that my kid being in class for less time is not going to give them better results. But we believe the quality of the education that they will be getting over those 9 days, because of the ability for their teacher to get all of those other supports and connection points done, will find them further ahead than the current model. So that's my commitment to you, that we're going to try this in a couple schools, watch it very closely, make sure it delivers results, and work with parents and work with the after-school and childcare communities to make sure that this is supported smoothly for everyone. Okay, it's 1:42, and I'm not nearly as far into the list as I'm supposed to be right now. Je vais changer la première question, le plus populaire.
So I'll switch to the most popular question in the French system, and this was a question about the cellular access. When will there be accessible signals for cell phones on Route 180? People on this road will feel safer with access to the network. And there was another question similar, which is, did the GNB ask funds to the CRTC to improve internet access in rural regions? So I will answer the question. Our team has been working on a contract for the building of infrastructure for new towers, which is necessary for New Brunswickers so that they can work and live anywhere in the province. We are hoping to be able to give you more information soon on the measures that we are taking to improve cell access everywhere in the province. And I appreciate the question about Route 180. There are many roads on which there is no cell coverage. We are trying to invest in the infrastructure with our partners to make sure that we have access to the network for your safety, and we are hoping to have information to share with you soon. The other question that I will answer is about healthcare. The question was about the working conditions in hospitals, which are horrible. It is because of the lack of staff. Having the 2-year course to become a nurse would be necessary. And yes, we need a healthcare system that can count on the people who are doing the work, who must be available and qualified. So we're working hard to remedy the lack of staff that we have in the healthcare system, and we're trying to create a work environment where the staff feels respected and supported and safe at work. We have a recruitment branch that is working with schools, post-secondary institutions to make sure that our programs are full of candidates to attract them. We are also working with EMA&B and the long-term healthcare sector. There are other things that we can do for recruitment and to improve working conditions. There are several programs for nurses. The nurses who want to increase their education or new nurses with solutions with the CCNB, Université de Moncton. So we are trying to understand if more people are interested in this career. Do we need more space or more bursaries, more financial help to follow a path in healthcare?
Because the next question on the English side that got 63 votes or upvotes was around the waiting list. So someone asked, why can't citizens be allowed to view their own position on the doctor wait list? There's a lack of transparency in how doctors are assigned, and people whose doctors leave New Brunswick are prioritized over those on the list. So that last point isn't, to my understanding, how the system works, and so I've made some inquiries about the list, and there's challenges, as we talked about before, in terms of how that data has been collected in the past, and where that list sits in terms of ability to share or make it visible to someone. And then we also have it now moving to a more geographic system because we're assigning patients to these new family health teams based on where they live and how close they are to that place and how long they've been waiting. So right now, when a primary care provider tells us that they want to take on new patients, they reach out to the NB HealthLink team to let them know how many patients they're requesting to add. And that's when we identify, okay, if this is that primary care person is looking to add this many patients in this region or postal code, who in that area has been waiting the longest. And I will say this is also something that I've been asked before that I wrestle with. It's not actually based on need, who has the most acute health needs, it's who's been waiting the longest, because we don't capture the health profiles of the people on the waiting list, even though a part of me thinks we should, because you want the people that need the most care or who have chronic health needs to be getting that care. But those who have been waiting the longest are the ones contacted for that postal code. So if you're in Charlotte County waiting for care and a new doctor comes on board in Caracat, even though you may be waiting longer than that person in Caracat, they're not going to offer the Charlotte County person to come and travel to Caracat to get that care. So there is a regionality to who's coming off of the list. There's a lot of challenge in projection of when a new practitioner might show up or when a doctor may ask to take on more patients. And so it's very hard to give people any indication of how long they're going to be on the list for, because that really depends on both the success of our recruitment efforts, the success of this transformation to the family health team model, and retirement decisions and other decisions from our current population of healthcare providers. So estimated wait times right now is not an algorithm that we've cracked. But as I said before, and I'll repeat it again, our number one focus is getting these family health teams in place so that every New Brunswicker has access to a clinic in their community, a team of healthcare professionals that have availability within a matter of days and that will have your health records and know you and your family so that when you come in the door, they have the right person to serve you. We're putting those family health teams in place all over the province, and every time we do, that increases their capacity to take more patients. So far we've had more than 5,000 new spots created by the investment in this family health team model. We're going to do 5 more of those clinics this year, and that's going to mean more people off of the wait list. And then we've committed to doing at least 30 of them across the province. But really the goal is create as many family health teams as we need to get every New Brunswicker attached to a clinic close to home as quickly as possible. We think that that'll take us into kind of 2029, 2030. I'd love it to happen, obviously, by 2028. I'd love it to happen as quickly as possible. And the good news is that doctors and nurse practitioners and others are coming to this model. They're putting their hands up. They're saying, I want to be part of the next family health team. I want to switch over my practice and take on more people and share with my colleagues. So the model is getting uptake. We're seeing it help us expand the number of New Brunswickers served. And that's the ultimate goal, is to get that waiting list gone. But the way that we reduce it now is when a practitioner raises their hand and says they'll take more, we take the people that have been waiting the longest in the geography around where they're based. So that's that one. It is now 1:50. I have 1, 2, 3, 4, 5, 6, 7, 8. Oh, a whole bunch of questions here. Okay, so we're going to go on to the next one, which is NB Power. No surprise that 58 people upvoted a question about NB Power. There's a couple of them in here, so I'm going to read them both and then share some information. So the first question was, why are we still paying outrageous electricity prices? This month after month wait of the audits and results from NB Power is unacceptable from a corporation run by our provincial government. And the next question that had 63 votes that was similar, how is it that NB Power is continuously allowed to charge an arm and a leg? We have installed more energy efficient solutions and our bill still went up. What's the incentive? So these are good questions on their own. They're also, I think, really indicative of what I hear from New Brunswickers out in community, is the challenges that people are experiencing with their power bills and their ability to pay those power bills. As something that we were hearing before we formed government, it's why we committed to taking that 10% off of power bills, and to that clearly wasn't enough, because rates were going up by 10%, and our 10% off that started in January 1st was right when it was getting colder and colder and bills were going up and up. But the government is taking off or discounting 10% of your power bill every month right now, and will continue to do so for the foreseeable future. We did ask NB Power to audit that smart meter or the spike in billings that we saw. They did conduct that audit that came back with without the results to point to the technology, that pointed instead to temperatures, change in rates, days of use billing, and now I think NB Power is going through the next process of telling us how they're going to respond. We eliminated the debt reduction target that was on NB Power that we felt was putting pressure on rates, because they had to achieve a certain debt reduction target by 2029. So in eliminating that, that changes the rate profile applications that they're going to put forward to the EUB and gives NB Power more room. Our hope is that means that these double-digit rate increases that were in part because of them trying to achieve this debt reduction target will be removed. But that's a Band-Aid solution, because we still need the debt to come down. But right now, the debt reduction was happening on the back of ratepayers. And then there is the comprehensive review that was mentioned, and I agree that it feels frustrating to have to wait. But we need to get this right. We can't Band-Aid solutions with NB Power. We can't keep artificially holding the rates down, something that governments have done for many years. That's what's got us in the debt situation that we're in. When we look at rates, the rates that our neighbors are paying in Nova Scotia, the rates that our neighbors are paying in Maine, they're paying higher rates than we are. So I know that people feel like they're charging an arm and a leg, we're paying outrageous electricity prices, but if you look at the rates they're paying in Ontario per kilowatt hour, the cost is lower here in New Brunswick. It doesn't feel that way maybe because of your bills and other charges and the usage and the fact that we've got more baseboard power, we're more dependent on coal than other jurisdictions, but the actual rate is lower at the end of the day. And we needed this comprehensive review to be done by this independent panel because we have to fundamentally shift both the financials of MB Power, its ability to pay down its debt, to maintain its assets, and to invest in the kind of generation infrastructure that's going to deliver stable, reliable, predictable power rates that are affordable to New Brunswickers. So that work is well underway. Hopefully some of you have had a chance to get to know or engage with the leads. They've done some public engagement. They're working with stakeholders. There's going to be more public engagement coming in the fall to talk to New Brunswickers about what they want from their power utility. And we're expecting as government to receive their review and recommendations in around March of next year so that we can move quickly to try to act on those recommendations and make the shifts we need to MB Power and its structure in order for you to have reliable, affordable power going forward. So there is no easy solution. There's no silver bullet. We will not be the government that continues to artificially withhold rates and rack up debt and not allow the utility to invest in the kind of renewable energy and infrastructure that we need. We're trying to do this in a way that's manageable, but the unfortunate reality is that power is getting more expensive everywhere. And that's putting a challenge on the utility, it's putting a challenge on government, and it's putting a challenge on New Brunswickers and their ability to pay for it. So we've got high expectations for this comprehensive review group and what their recommendations will come to, and we really want New Brunswickers to engage in that conversation with us about the options for how you consume power, how we generate power, what that looks like for you and your family going forward. Okay, next one was a question about early childcare, and that had received 60 votes, asking if we could clarify why some legitimate provincially supervised daycares have had their fees only brought down a certain percentage, but have never reached the $10 a day that was promised. And so I had to do a little bit of learning about this one because I'm told that when the federal government originally announced this program, they described it as an average of $10 a day. That often gets, I think, missed. There are some people that are paying $0 and some people that are paying more, and the goal was to have that average be the case. Here in New Brunswick, when we signed the agreement originally with the federal government, we reduced fees by 50% in those first 2 years. That was part of the agreement. And then the requirement was to reduce to that average of $10 a day by the end of March of 2026. So we've been operating on that timeline. The average, again, right now, the average in New Brunswick, I'm told, is $12.85 a day, and that's based on your income. So as I say, some people will pay $0. Other people are currently paying $18 a day for childcare, and so that still averages out to be above $10 at $12.85 in New Brunswick right now. The goal is to get that lowered down to an average of $10 by March of next year. But because it's averaged and due to income, some people will still find themselves paying more, other people find themselves paying less for that daycare service. So for the person who asked the question, there is more work that we are doing to get those daycare costs down, lowered for everyone. But how the people experience that $10 a day will depend on where they are on the income spectrum. Switching over to another healthcare segment of questions. This time, this one received 60 votes and was being asked, what are you doing to ensure that every New Brunswicker has access to a primary caregiver? My family and I have been without one for 5 years. We've been on the list from the day our doctor retired. And similarly, a question with 46 votes. We need access to doctors. Free up the ERs. Can we have real walk-in clinics? They would be useful for minor needs, quick antibiotics, refills, minor infections, freeing up the ERs and freeing up GPs. I'm going to try to do this one a little bit more quickly since I talked quite a bit about what we're doing on primary care. It is our #1 goal to get more doctors, more healthcare professionals into primary care in community family health teams to cover every New Brunswicker in this province. And so we're doing that work on the compensation side, we're doing that work on the structure side, to make this an attractive place for doctors to choose to start their career or move their career. So far, we've had 5 of these family health teams established, taking more than 5,000 patients off the wait list. We've committed to 5 more happening this calendar year and 20 more on top of that in the years to come, putting nurse practitioners and allied healthcare professionals and doctors together so the right person can see the patient in a timely way and allow that clinic to take the pressure off the hospitals. We do have some of those as you described them. I think we call them urgent care clinics, but those are the non-ER, we'll call them minor, but they're semi-minor, right? Like you still need to see someone and you still need to see someone in a timely way, but you can get access to those antibiotics and supports that you need. But ideally, minor ailments are going to your family health team to be seen by that nurse or that member of the team that can help with the problem. Une autre question en français.
Another question in French. This one: why does the university not recognize the 2 years LPN program, and have to do another 3 years to get their bachelor's? When or will they be recognized by the province, depending on the countries? And there were 2 other similar questions: why LPNs must pay costs to make the bridge to become an RN, while immigrants, all the costs are covered. And third question, LPNs are nurses in the hospitals for tomorrow, and they already work with the same patient ratio as the RNs. Give them 2 years training freely to obtain their RN. These are interesting questions, and I must check with the University of Moncton to better understand what the process to force an LPN to do the 3 years and why that is the case, and as well why they recognize assets for immigrants but not the abilities of the local ones to offer what courses. And first, for what is covered, I believe, I don't think it's a question of where you come from to obtain your costs covered. There are application processes for bursaries, for financial help, and these are programs that LPNs in Canada can apply for, and for those who are from outside Canada. So we often recruit nurses trained from outside because we have a lack of nurses, and we focus on people who are already registered as nurses in their own country to help them to come here, because we're hiring everyone that completes the program in a university. And we recruit them for nursing homes, for hospitals, and for the home care as well, that we're looking for a lot of people. But I appreciate the point that we want it equitable. We want that opportunities exist so that everybody can obtain training as a nurse and to fill positions with the same costs or the same opportunities for funding as all the others. So for this one, I'm going to do a bit more research and learning to understand what is the difference for the points that were mentioned here.
And unfortunately, that leaves a whole bunch of questions that I thought I was going to have time to answer off the list, including a property tax question that I'm dying to answer, but I'm not going to because there's questions, more DTI questions, more healthcare questions in there. So I hope that for some of you, you got your healthcare question or your education or your childcare or your DTI or your government technology and service question answered. I want to recognize again that hundreds of people submitted hundreds of questions, and I really appreciate that. It helps us understand what you're thinking, what information are you not getting from us, and how can we find ways to learn to. Some of these questions are questions I'd never heard before, didn't know the answer to, and had to go out and ask the departments and folks to help me understand them. Alors, ça nous aide beaucoup quand vous engagez avec nous.
So it's really helpful when you engage yourself with us. So you're asking questions, and we're voting on the questions so we can see which ones are the most interesting. And when there are 80 people here or 60 people that are all interested in the same issue, it helps us to find out where we should invest our energies in better communications, in more visible work for everything that is being done to try to improve your access to healthcare, your access to information, and progress with our infrastructures. So thank you, everyone who participated and came here to see the program today and who are asked questions.
Watching this today or who asked their questions and voted on questions. We continue to want your feedback. We're going to do a bit of an evaluation of these 2 Q&A sessions and this model of soliciting and capturing and voting on questions to see if that's the right one going forward at the right frequency, because in another month's time we're going to be into September, into the school year, into the legislature, and so we'll also look at the frequency of this to determine what works best. But all that said, thank you for caring about New Brunswick. Thank you for caring about good government in New Brunswick and engaging with me and with us to make this province that we all love better. Hope you have a great Tuesday. Merci. Au revoir.